Welcome to the THOR Table of Knowledge podcast, where we dive deep into the groundbreaking world of trauma care, hemostasis, and oxygenation research. A special thank you to our sponsor, Velico, for their support. Velico is revolutionizing trauma care with their innovative frontline ODP spray-dried plasma system, with the goal of empowering blood centers worldwide to produce dried plasma for transfusions.
This is a very special one for me. We're here today with the leadership of the Allo Hope Foundation, Molly, Bethany, and Katie. So I want to start off, Bethany, with asking you, how did you start the Allo Hope Foundation? What's the background to the group?
Well, as you know, I'm an allo-immunized mother myself. And so, and by the way, I'm the founder and executive director of the foundation now. And so going way back, when I first found out I had these antibodies, I was overwhelmed. I'd never heard of this before. And in the end, my daughter died halfway through the pregnancy due to HDFN, hemolytic disease of the fetus and newborn. And that is basically a condition where my husband has a different blood type. And so I developed antibodies against that specific blood type. And then when I got pregnant afterwards, my immune system attacked my baby in utero, causing fetal anemia. And so that's what happened to my daughter. And then with the right care, I went on to have 3 healthy babies. And during that whole period, sorry, hold on. You can just cut that. Okay, wait. So during that time, I met so many women from around the world who had reached out to me for help. And I realized that they also were struggling to find the right care during their allo-immunized pregnancies, and babies were dying preventable deaths. And so that's what sparked the Allo Hope Foundation.
And you've done a very impressive job. It's really changing practice around the world and saving so many lives. I think what the 3 of you have done is truly amazing, and part of why the THOR network is so interested in continuing to work with you and help you achieve your mission. But we got introduced to each other through a research project that we were developing, and we realized that we may be putting some girls and women at risk of developing antibodies and being at risk of HDFN. And we were put in touch with you, and you've been very helpful to us with advising us on the optimal way to not only design the trial, but to advise girls or women who are exposed to a certain type of a blood product that would react with the female. And it's been a great collaboration, and that's how Allo Hope Foundation kind of got linked to the THOR network. And you all have been so influential that we are now having every trauma center that uses whole blood are using patient information sheets to not only explain what alloimmunization is, also then what to do about it. So it's been really important to us, and we're glad to continue to work with you all.
Yes, and we've been so impressed with your care for women and children involved in transfusion medicine, and just the way that you have helped us and supported us in our mission has been amazing. And I just want to add really quickly that the education piece, like you were saying, is so vital when it comes to HDFN and alloimmunization. And that is a lot of what we do. We provide educational resources to the patients, their families, and then the providers as well. And advocacy, support, research initiatives. We do a lot, but getting that information to the people who need it most when they need it is vital.
So for those of you listening to the podcast, and if you're involved in either transfusion medicine or taking care of patients who were transfused, or pregnant women, I think they really need to be aware of the Allo Hope Foundation and your ability to help both patients and practitioners on the optimal care for an allo-immunized woman. It's really important. So we'll continue to do everything we can to increase your visibility and get your word out there. So Molly, you're the director of research. What are your current main projects, and what are the research projects you would love to get done if there was funding available?
Well, we are so lucky that, like Bethany, I'm an alloimmunized mom myself, and my background is in clinical and regulatory strategy. And once I navigated my own alloimmunized pregnancies and saw counsel from Bethany as the foundation was starting to really blossom, it became super obvious that we are so lucky that we have the reach that we have with thousands of patients, and we have the opportunity to learn from them and watch their journeys over and over again. But for us, the next step to translating that into something robust and actionable is turning that into research. And so we can leverage the patients who we love and try our best to represent and advocate for because they want to be a part of improving care too. And so that for us has so far included a lot of patient centered research initiatives, comprehensive kind of natural history studies to understand what patients are really going through in their HDFN pregnancies and try to paint a picture for the reality that we see globally for HDFN. And so I think that long term, continuing to build on the studies we've already done that are survey based or they're more qualitative and leaning on more funding. We do have funding from the Patient-Centered Outcomes Research Institute right now that we hope will be able to lean on and continue long term and really start to implement comprehensive patient support models and see how that improves care because we see that in our work daily. But if we could show and prove this really works, babies live when they have an empowered mom is connecting with her clinical team and finding the right care every time. We don't see babies die from HGFN. And so telling that story and proving that this is what we should be expecting and be done through research, and it just improves our visibility. So that's a huge part of our.
Right. It's interesting in the trauma world in the past 15 years, we've come up with a goal of 0 preventable deaths from traumatic bleeding, which is kind of similar to your, 0 alloimmunized related fetal deaths. And I think that's part of the reason why our two organizations have connected so well because it's a similar goal, just different disease processes, really.
It overlaps really well because we
Yeah.
want the same thing. We just want
Right.
people to live. It's just that
Yeah.
the people we're talking about are tiny Trinity people. Right? But it's the same principle that we're implying throughout. And I think
Yeah.
the motivation is the same.
But we also care about women and girls in trauma situations who need emergent transfusion.
Right. You have to live through the trauma to then be able to get pregnant.
Yeah. And I think there's a way for everyone to have the best care and the best chance of survival. Yeah.
So, Katie, you're the director of development for the Allo Hope Foundation. I know one of the projects that you're passionate about is the work that you're doing in Africa, maybe in Kenya specifically. So, tell me more about what you're doing there and the long-term goals.
Sure. So, in addition to being the director of development, I'm also Allo-immunized, and my son was severely affected by anti-D antibodies because I didn't get a preventative medication called Rh immune globulin. And through this work, and after Bethany counseling me through my pregnancies, we've noticed globally that there are many women that actually don't have access to this preventative medication as a standard of care like we do here in the US and in developing countries. And so what we're really trying to do is raise awareness and get access to Rh immune globulin for women in Kenya, because not only do they not have prevention, they also don't have any sort of high quality care. And so there are lots of preventable, devastating deaths that are happening. Um, and so that's kind of like our passion right now is to really help in those countries.
How can people who are listening help with that mission?
So we have a couple initiatives, but the one biggest initiative is our AHF Africa program, which we're currently fundraising for. This goes to provide RhoGAM doses for women in Kenya. Currently, the foundation's only able to fund 5 doses per month. The cost of each dose is only $75, which to us doesn't feel like a lot, but in Kenya, it's half of the average monthly income for Kenyan families. And so they often have to forego it just to pay for basic necessities. So if they are interested in helping us with that initiative, that'd be wonderful.
I imagine they could visit your website, and there are ways to get involved and to help support these types of missions. Well, it's been a fascinating conversation. As always, the three of you have really doing amazing work. And THOR is always here to help you with that mission. So thank you. So that concludes this episode of the THOR Table of Knowledge, and Skull.
That's a wrap for this episode of the THOR Table of Knowledge podcast. A big thank you to our sponsor, Velico, for supporting the advancement of trauma care. Their frontline ODP spray-dried plasma system is paving the way for blood centers globally to produce potentially life-saving plasma for transfusions. Check out our website, www.thornetwork.com, for more podcasts, and join us next time as we continue to explore the cutting-edge science of trauma, hemostasis, and oxygenation. Until then, stay safe and stay informed.